Hello and welcome to all of our gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife, and I am here today with Ibukun Afolabi. I am so happy that you're here. And Ibi, you like to be called Ibi, right?
Yes, great.
Good to have you here today.
Lovely to be here. Thank you.
So you are part of our add-on package for our Gold Midwifery online conference of 2026, and that's just around the corner. The beginning of the month, February 2nd, we get started with our free and open access keynote presentation. And the package you are part of is titled the Gold Postpartum Care in Practice, Clinical Strategies for Physical and Emotional Recovery. And there's some fantastic lectures in that package. And your presentation is all about pelvic health, extending the continuum of care, pelvic health as a vital sign in postpartum recovery. Before we go into the topic, Ibi, tell us a little bit about yourself. Where in the world are you? And tell us about your professional background.
Absolutely. I am located in Canada, so I'm in Ontario, London, Ontario, and I am a physical therapist. So I've been practicing for almost 20 years, but the majority of that time has been in perinatal physiotherapy. So almost, well, 99% of my caseload are women who are pregnant or postpartum within a few years of having their babies. And I'm a pelvic health physical therapist as well. I'm also a doula and I love childbirth and I just inhabit that world.
Wonderful. Thank you so much for talking about that. Yes, the your postpartum. You mentioned that you work with clients prenatally as well, which is absolutely fantastic. I tell my clients as well to see a pelvic health specialist, therapist early, also during pregnancy, because there's so much you can do also in that time. But let's say we didn't have that chance to work with a client prenatally, and now we're in the postpartum in postpartum recovery. And I feel like the pelvic health is slowly but surely coming more into the foreground. But here's the thing: as midwives, we have the good opportunity to make sure that our clients be referred if they need to, but we have that six week window most often, right? But postpartum extends to so much longer, and I think, and you are one of those people who really are passionate about extending that window, and that it's not just that little 6 weeks part, but really a longer time. So help us. How should we reframe the postpartum when it comes to the pelvic health?
Yes, that's a fabulous question. We need to understand that a woman, she's living on with her body, right, beyond the
Mhm.
6 weeks. And what happens in the first 6 weeks postpartum and at the birth will have ongoing impact and repercussions and echoes into her full postpartum year. So at the minimum, I think we really ought to, as healthcare providers and in the research world as well, zoom out and be able to see postpartum as beyond the 6 weeks, right? Things don't just magically all come back together
Right.
and functioning at 6 weeks. It can take women quite some time as they're healing and as they're also navigating changes in other parts of their life as well. And we can even, some people can even think about just the childbearing frame of a season of a woman's life. We can imagine that she might be postpartum multiple times, and how is this impacting her lived experience and even into that next big transition phase of her life, which is menopause. So they're all related and connected.
All related and connected. Oh, that's wonderful to hear. So some of these pelvic health issues are very obvious, especially to midwives, especially if there was like suturing involved and certain other things. But what would you say are some more surprising or under-recognized or under-diagnosed symptoms that we as midwives should be aware of?
Oh, yes, another very good question. So one thing I might talk about is cesarean sections. So,
Hmm.
the rate of C-sections is going up, it seems.
Right.
And some women or providers believe that a cesarean is protective of pelvic floor issues, but that's not actually what the research shows. And so when women have a cesarean section, they will get sutured up, the incision will heal, and the fascia and the connective tissue and the uterus itself, there's all been disruption and impact to that. The uterus is settling back down into the pelvic bowl. The fascia is subject to scar tissue, and so this is going to have a direct impact on her functioning of her pelvic floor. It can show up as pain. Sexual pain is something many women surprisingly have following cesarean sections. And that's something that's unexpected and surprising because there was no perineal tearing or suturing. So that is
Mhm.
something to keep in mind, as the midwife. And there's other sort of more invisible or surprising things that can show up deeper in the pelvic bowl. The position of the uterus, where it lands, is that something that is central, or is it putting more pressure on the bladder, for example? Could this be leading to more incontinence or more urgency or frequency?
Oh, that was a very good point. That definitely is a little bit of a surprising point that you mentioned. Maybe we're not always aware of, if a client comes back into our care, let's say that she had a C-section, we're doing the postpartum care, we
Mhm.
might not even think about that as an issue, but it is a very good point. So thank you for pointing that out and teaching us something here in this presentation, and not only in the presentation, but also here in our little chat as well. Uh, so I would like to talk briefly about the big picture, for decades. I mean, as long as I remember, it was always seen as such a normal thing for women after childbirth and, experiencing incontinence. Even I remember even my mother-in-law was saying to me 20 some years ago when I had my first child, oh, you'll get used to it. That's your life from now on. But it doesn't have to be, number one. And number two, we need to talk about this, and because we have to educate the future generations, our children, about this as well. So tell me, how do you approach this with your clients, maybe with your own children? What tips can you give us there, so we come out of this constant, this is the way it is and you have to suffer, that's it.
Yeah. I have a lot of hope for the future generations. There's so much information accessible at the touch of your phone these days. The shame and the shrouding and the hiddenness of these female pelvic health conditions and issues isn't there to the same degree that it was with my mother's generation or my grandmother. And there's been this permission, I think, societally, at least in Western society, it might be coming along, in other places as well, to start having these conversations. And women want to be able to participate in their life. They want to be able to jump on the trampoline with their kids, and they want to be able to run. They don't want to be held back from the things they want to do because of the limitations with their body. And so I see that people are challenging these scripts. They are saying no. They are finding ways to get help and various different people who can help them with their healthcare. And that's just the mentality. I think the generation that is having babies now, their mindset is, I deserve to be able to fully
That's good.
participate in my
Yeah.
life.
Hmm.
And I think that's great. I think it's fabulous, and it's going to continue to cause healthcare providers and to be able to keep up with that and be able to
Yeah.
help women, right?
And
So yeah, it's
yeah,
very
and
encouraging.
get the education they need to be able to support their clients. Absolutely.
Yeah.
My last question here for you, Ivy, now is, what are you hoping our viewers will take away from your presentation?
Yes, I think that the thing I would love them to take away from the presentation is that midwives are beautifully and strategically positioned to advocate and to educate and they can make a real difference in the life of their client. So if they bring up the conversation, if they provide some resources, if they talk with their clients about what they're experiencing, it gives that client the permission to also talk about it and to perhaps seek care and to not live in dysfunction and to be able to participate with some of the things that she would like to be able to do. It really will change the trajectory of her life and her experience with her own body. So that's my big takeaway. Don't be shy. Talk about pelvic health. Break it up. And use your knowledge and expertise and your resources to really help your clients beyond the time that they are with you.
Well, thank you so much, Ibukun Afolabi. It was
You're
such a
welcome.
pleasure having you here today, and I'm looking forward to your presentation.
It was lovely to be here. Thank you so much for including me.
And now for viewers, again, this is part of the midwifery add-on package that we have for 2026. The midwifery conference starts February 2nd with our open access. It's completely free, this presentation that we have our keynote presentation on that day. And if you would like to find out more, please visit goldmidwifery.com. I hope to see you all at the conference. Bye bye, everyone.